Do you ever feel that sometimes other people seem to get all the referrals and that you're kind of overlooked? I'm Dr. Cass Spencer-Smith from Private Practice Ninja, and in this video we're going to be talking about how to get over the problem of explaining what it is that you do. This week I had a conversation with an amazing osteopathic colleague of mine. He's fantastic and he works in a big shiny clinic, and he confessed to me that he was getting fed up with seeing all the surgeons referring patients purely to physiotherapists. Now, if you're an osteopath, maybe you've experienced this, and perhaps it gets right up your nose too. Now, in my sports medicine career, I've had the good fortune to be educated by osteos and physios and strength and conditioning people, but not everyone in the MSK world has mixed with different kinds of colleagues. So I recently asked one of my surgical colleagues, a knee surgeon, and I asked him, do you ever refer to osteos? And he says, well, I don't really know what they do. Don't they just crack backs and necks? Why would I want to refer them an ACL rehab patient? I resisted the urge to punch him on the nose, but in some ways he's right. He doesn't really know what they do. So I was thinking, rather than us getting defensive saying they never refer me patients, wouldn't it be better if we try and educate other people about what we do? And in return, it's super important that we spend time immersing ourselves in different clinical spheres so we can understand how those clinicians can help our patients. And don't forget, it's not just the clinicians who might have their blinkers on. Sometimes patients do as well. They may think that only a psychiatrist is the right person to help them, when in fact an ADHD nurse may be even better at helping them. Or it might be that I want to refer, say, a patient of mine who's got a hip problem to an osteopath for rehab, and I'm going to have to talk up the osteopath to the patient. And sometimes I have to use these analogies. Well, it's a bit of a Venn diagram. There's a big overlap between what physios do and what osteos do. And even amongst their own disciplines, they may have unique special traits that are individual to them that the other physios don't have or the other osteos don't have. And we have to remember that sometimes people like myself will be referring you patients. We're selling you to the patient if you're a clinician. So do yourself a favour and help us to help you. What am I really trying to get at here? It comes down to the problem of difficulty around explaining what it is that you do. So many podiatrists, neuropsychiatrists, etc. tell me that they find it difficult to explain what they do. And I get that. They've got a mix of skills. It's really hard to distill that down into a few words. So today's message is very much about using storytelling to explain what you do. Let's take the example of my osteopathic colleague who works with elite golfers. He might say something like, this chap came to see me and he'd had back surgery, facet joint injections, he'd had physiotherapy, clinical Pilates, hydrotherapy, and he was still struggling with pain every time he picked up his club. So when I saw him and we played around with some movements, it became very obvious that actually he had a very stiff right shoulder. So at the top of his golf swing, he couldn't actually get into the correct position. So when we worked with that and then we played with his feet a bit better so that when he addressed the ball, his balance and load was correct. And then what happened was his pelvis and shoulders moved together, which meant he stopped compressing his lumbar spine laterally. Voila, his back pain stopped. And with a bit of strength and conditioning and repeated movements, he got it nailed. And if I was listening to that story, I'd be thinking, wow, this person solved a problem where other people haven't been able to, and they've really solved the problem. They've not just plastered over on it. They can visualize the better movements. And you don't have to explain how you spotted the shoulder problem. You just need to explain the transformation that it brought about. That way, when I meet a golfer with back pain, I know you're going to be my go-to person. And if you're struggling about how to get your message out there about how you help people, why not consider joining the Private Practice Ninja Academy? I'm Dr. Cass Spencer-Smith at Private Practice Ninja, and I'll see you next time.